From the nation's capital, Eye on Washington with Marilee Joyce. A weekly discussion about the federal issues most important to Nevada. And now, from Washington, D.C., here's Marilee Joyce.
And good day to you. I'm Marilee Joyce. This is Eye on Washington. It's the only statewide Nevada news program produced in Washington, D.C. Every week, Eye on Washington takes you straight to Capitol Hill for a discussion with Nevada's delegation and other leaders about the federal matters that matter to you. Today's topic, why Nevada's youth and Nevada's elderly are topping suicide statistics and what can be done to reverse this irreversible decision. My special guest today is Miss Shannon of the American Foundation for Suicide Prevention. Thanks so much for being here today on this topic.
Thank you so much for having me.
So here's the good news. Last June, the Centers for Disease Control released a report that Nevada is the only state in the nation where suicide is down. But be that as it may, the state does rank 5th in the nation. And for 2 age groups, things remain especially troubling. And today on Eye on Washington, we're going to look at suicide rates among Nevada youth and Nevada elderly. We'll learn why these 2 groups might be particularly vulnerable. We'll find out what to do if you think your loved one is contemplating ending his or her life, and we'll ask my guest what needs to be done on the Hill and in the state to turn things around. Now, last winter, Dr. Leslie Dixon, the head of the Nevada Psychiatric Association, led a presentation for doctors and other medical personnel called Suicide Prevention: How to Save a Life. The seminar was very timely. The Las Vegas Business Press reported last February that Nevada's suicide rate has jumped to number 5 in the nation. That is the highest level since the late 1990s. So Dr. Dixon and other prevention advocates are urging Nevada medical professionals to get out front in recognizing suicidal tendencies in patients and hopefully getting them the help they need before they end their lives. Dr. Dixon's session addressed nearly 100 doctors and others in healthcare on several hypothetical situations they may encounter when dealing with suicidal individuals, as well as discussions around possible outcomes and practices. Now, Ms. Shannon, first of all, welcome to Eye on Washington. You know, we've covered suicide, as I told you when we were preparing for today's show. We've covered it many times from many angles on my program. But the rates among Nevada's youth and elderly are so troublesome that I thought it was important that we address this again and to have you on to talk about this. So we'll get to those groups, what's being done and what needs to be done later. But I do want to look at the growing focus on doctors to notice and hopefully prevent suicide. That is good news for you. I know that it really part of your reach out, isn't it, with your group?
Absolutely. In fact, the American Foundation for Suicide Prevention has an initiative called Project 2025. And with that, we have identified some of the key ways in which we believe that if we focus our attention, we can reduce the suicide rates in the United States and beyond the fastest in the shortest amount of time. And one of those ways is actually to work with emergency systems and healthcare professionals in order to increase education on how to spot the signs in their patients, but also to give them adequate follow-up care to make sure that if they are showing those signs, that they don't fall through the cracks of the system, that we get them continued support.
Yeah, you know, I thought Dr. Dixon's seminar was really timely, you know, especially regarding the 2 groups we're going to get to later, and to really addressing the group, to the, you know, the healthcare leaders themselves. Your mission statement says that you focus on evaluating and disseminating accurate information about suicidal behaviors to the public, and certainly that includes those kind of at the front line on this, which are the medical and other health professionals, right?
Absolutely, absolutely. We know that we can save lives through education, and that's working with, you know, educating healthcare professionals, whether it's mental health care professionals as well as physical health care professionals.
Because often those are the people that are dealing with these individuals and maybe have kind of gotten clues from them that could be followed up on.
Yeah, we believe that it's key that, for instance, let's say you go to your primary care physician, as many of us do. And if you were to go into your primary care physician for a routine exhibit, let's say you are exhibiting some signs, or maybe there is some kind of survey you can take while you're in there that would give your primary care physician a clue about your mental condition. And so if we can start identifying it during routine health checkups, because let's face it, this is a health condition just like any other. So if we can identify that early and take early interventions and provide adequate care, we know that we can save lives. Absolutely.
You know, I saw a quote from Dr. Dixon saying that interventions by mental health professionals are very important, but that many suicidal individuals never see a therapist. And that's why people like her, and you, I know, stress the importance of all people who interact with a suicidal person knowing how to help, right? It's not
Absolutely.
just those medical professionals we're talking about, but every average Joe know how to recognize this and help.
Yep. We at the American Foundation for Suicide Prevention, we're trying to create a culture that is smart about mental health. And that's from everything about teaching everyday people like you and me how to spot the signs, who's at increased risk for suicide, what can we do to reach out and have a meaningful conversation with someone we're worried about, and know what resources are available in our community to help those who may be struggling. And
you know, it's more and more important. We're almost out of time in this this segment, but I wanted to just touch on these horrible statistics that really led to me doing another show on this. These are from 2015. They're the most recent from the American Association of Suicidology. Nevada had 650 suicides, just under 2 a day in 2015, and that is Nevada's highest rate since 1997. This is a horrible situation that's not going away or getting that much better.
Yeah. Unfortunately, suicide is the 10th leading cause of death in the United States, and it is the only leading cause of death that is still on the rise. But there is hope. We know it is preventable, and there are steps that we can take.
And we're going to let you tell us about them. And just ahead, though, is your child contemplating suicide? We're going to give you the stats and the signs to look for right after this.
You're watching Eye on Washington with Marilee Joyce, brought to you by Caesars Entertainment, the Regional Transportation Commission of Washoe County, the Las Vegas Sands Corporation, the Las Vegas Convention and Visitors Authority, NV Energy, Jim Marsh Automotive and Body Shop, the Rogich Communications Group, and Renown Health.
I have 3 tests next week. I'm going to be studying all weekend. Ugh. Are you studying tonight? We can meet up and study together. Oh yeah, that sounds good. What time? I work until 6. Okay, sounds good. Just text me after. Okay. No!
There is no text, tweet, or call that's worth a life.
One pedestrian death is one too many.
Look up.
And look out for each other.
Want more federal news that affects Nevada, its businesses, and its residents? Then you need to subscribe to Nevada's Washington Watch newsletter, your sole source of online news direct from Washington, D.C. Visit joycecommunications.com and subscribe today.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
I got my own iPod Touch and use my dad's login to get on gambling sites. Poker is the best, but I'm losing a lot. Since I'm too young to play, they're not allowed to keep the money and my dad won't find out. That's right, isn't it?
Selfless service is the principle that guides Army National Guard soldiers to be ready whenever disaster strikes. They have a stake in the well-being of the neighborhoods where they live and work. They train part-time to be ready to serve at all times. Selfless service. It's what inspires the men and women of the Army National Guard to be part of something greater than themselves. Visit NationalGuard.com to learn more.
And welcome back to Eye on Washington, our look at suicide prevention, and especially at 2 Nevada age groups leading the sad statistics for those ending their lives. My special guest today is Miss Ellen Shannon of the American Foundation for Suicide Prevention. Earlier this year, the Nevada Division of Aging Services hosted a mental health first aid conference in Reno and Talk About Timely. According to the CDC's 2016 report, suicide has been the second leading cause of death for Nevadans aged 10 to 24 for the past 14 years. That January course taught participants what to look for regarding a variety of mental health challenges common among adolescents, including anxiety, depression, psychosis, ADHD, substance use disorder, and more. While those in attendance were not taught how to diagnose or provide therapy or counseling to youth exhibiting symptoms, they did learn a 5-step action plan to support an adolescent who might be dealing with emotional or mental crisis. First, group leaders said you should look for this. You should assess risk of suicide or harm, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, and encourage self-help and other support strategies. And Ms. Shannon, what studies has your group done recently on this age group, and why do you think this group is so vulnerable?
So we know that suicide is a complex health issue, and there is no one reason of why anybody makes an attempt or dies by suicide. It's always a convergence of factors that come together at a point in a person's life. So when we're looking at someone's risk for suicide, whether it's youth or any other population, we want to look at health factors, meaning are they struggling with a mental health condition or even a physical health condition at that time, because we know that 9 out of 10 people who die by suicide are struggling with a mental health condition at the time of their death. So it's really important to identify health factors, and including physical health conditions or experiencing chronic pain, or if you have had a head injury in the past. We also want to look at environmental factors. So what kind of stressors may that person be experiencing on a day-to-day basis? Are they experiencing harassment or bullying in school? Are they experiencing some kind of trauma at home, some kind of neglect or abuse, things like that that could create emotional stress, either over long periods of time or even short term. And we also want to look at environmental factors, including access to lethal means. That's incredibly important because we know crisis moments are temporary. If we can put time between a crisis moment and access to lethal means, we know that we can save lives. Absolutely.
So, we're going to share the signs and symptoms to look for in anybody contemplating suicide in a bit. But I know you touched on kind of the overall look for mental, emotional, et cetera. But if we could zero in a little bit of what in particular we might look for someone between age 10 and 24, that group that's been the second leading cause in Nevada.
So when looking at warning signs, particularly in youth, it's sometimes challenging because it's a transitional period in which there may not be routine
It might
behaviors.
be easier in the older group. They might be a little more consistent in what to look for?
It depends. It's really a lot about how, if you have a relationship with somebody and you know them quite well and you start seeing changes in their behavior, perhaps not for the better. So if we're looking for risky kind of behavior, maybe for youth, but this also applies to anyone because it really is across the board. So we're looking for risky behavior, acting recklessly, acting aggressively sometimes as well too. Increased use in drugs or alcohol abuse. Also, is the person now sleeping all the time? Are they acting lethargic? Are they basically starting to step away from things that they normally enjoy? Are they secluding themselves? But then there's also the flip side, because it's not just that. We can also looking for the person who may be not sleeping at all, not eating, is really the overachiever, is striving for perfection. So there's really so many different things.
And again,
that we
is
can
there
look
anything
for.
special in children or in younger?
Well, I think what's really challenging is because of that transition is a stressor at that point. So whether you're transitioning through your teen years or even into your changes in routine of graduating from high school and either transitioning into college or transitioning into the workforce, whatever it may be at that time, when we experience those transitions, we lose our day-to-day routines and our norms that keep us healthy. And so it's really important that through any life transition, whether it's for teens going into adulthood or seniors growing into retirement, whatever it may be, we want to create a good routine And if we know we struggle with a mental health condition, we want to work with a mental health care professional. We want to take active steps to keep ourselves healthy.
We're just about out of time on this segment, but I did think that you would like that course in Reno was aimed at anyone who works regularly or interacts with youth. So teachers, athletic coaches, mentors, juvenile justice professionals, hospital staff, faith communities, law enforcement, the general public, everyone who might come across someone in that age group. And I know your organization stresses the need, again, for everyone to play a role in helping to end this tragedy.
Yep, and we have a lot of resources that do exactly the same thing. We have educational programs that we provide at no cost. They're all evidence-based and research-based for schools, community groups, faith-based organizations,
and we will give your website and everything else when we come back. And let's break here. Let's say when we return, the unwanted first place ranking suicide among Nevada elderly is the highest in the nation. Why is that? What can be done to help? We're going to ask my guest about it next. Stay with us.
Nevada's direct link to Capitol Hill. Eye on Washington with Marilee Joyce. The only statewide Nevada news show based in Washington, D.C. All the top federal matters that matter most to Nevadans. Marilee talks with our congressional delegation and other leaders about the federal news you need to know. Eye on Washington with Marilee Joyce. Nevada's Eye on Capitol Hill.
When you think RTC, what comes to mind? How about jobs? RTC road projects bring thousands of jobs to Washoe County, expanding and connecting northern Nevada, growing our local economy, providing a more secure future for our residents and their families. So when you think jobs, think RTC. Your RTC, the RTC of Washoe County.
I was given a prescription opioid pain medication that lasted a lot longer than the pain itself. At the time, I didn't understand the dangers of these drugs, and within only a few months, I was completely addicted. I lost everything. I had to leave school and stop playing sports in college, and I started to watch my life slip away. These drugs are addictive. One prescription can be all it takes to lose everything.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
I want to eat apples and bananas. I need to eat apples and bananas. Why can't I eat apples and bananas?
Support the Feeding America nationwide network of food banks to help provide meals to those in need. Join us at feedingamerica.org.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions, and all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
Welcome back to Eye on Washington, our look at suicide prevention, and especially at two Nevada age groups leading the sad statistics for those ending their lives. My special guest today is Miss Ellen Shannon of the American Foundation for Suicide Prevention. The suicide rate among Nevada youth is alarming, but an equally worrisome trend is suicide among the state's elderly. In fact, Nevadans age 65 and older top the nation for the number ending their lives annually. The CDC reports that 32 per 100,000 Nevadans in this age group are ending their lives. That is double the national average. The 2013 census drives more sadness about this home. It says 60% of Nevada seniors who committed suicide saw their doctor within a month prior to their death, and 25% told someone they planned to take their life. Another 20%, it says, experienced a traumatic event 2 weeks prior to their suicide. The risk factors differ from those among youth. The Nevada Aging and Disability Services Division says top risk factors are diagnosis of a new illness, chronic diseases, pain, disability, medication interactions, social isolation, poor nutrition, substance abuse, loss of a loved one, and caregiving issues. Ms. Shannon, the division's report also mentioned that dementia might be more common among seniors who end their lives. But again, you know, you and other suicide professionals, we're looking for similar things among all age groups, as you said, and it's very hard to differentiate one group from another. I did find it interesting that the Nevada Aging of Disability Services Division does point out that as an elderly person, you might be susceptible due to some things experienced more at that age, more chronic pain issues, more disability, more social isolation. I read that that's very common among the elderly, maybe poor nutrition, although that can hit any age group, I suppose, and of course caregiving issues and dementia. But again, we're looking for some things that are similar among all age groups. Isn't that right?
Absolutely. So when it comes to risk factors, the senior population, aging individuals, are at increased risk because they experience more health conditions that could be stressors in their lives, whether it's physical health conditions and things along those lines that could then create mental stress.
Loss of a loved one might be more common among that age and lead to more depression, etc.
Also transitioning out of the workforce, maybe becoming an empty nester. So when you go through those life transitions, it's really important to keep a sense of self-purpose, to keep engaged and social, remain active, again, keep healthy nutrition, just like you said, to really keep up that activity, to keep that self-purpose and to remain active in your community.
You know, we don't have a lot of time in this segment, but I thought it's very important to again point out something that Dr. Slonim of Renown Health talked about on our show that we did several months ago. He told us that Nevada ranks dead last, that is 51st, for access to mental health treatment. That has got to play a big role in the difficulty of, say, medical professionals being able to jump in and help someone who's contemplating ending their lives and getting them referred to the mental health services they need, doesn't it?
Yes, absolutely. Access to mental health care is completely vital because your mental health is suicide prevention. Let's face it. So if we know that people can get access to mental health treatment at the early onset of depression or anxiety or any other condition, and we can treat it early on, we know that we can prevent them from contemplating suicide down the road.
And when we return, what needs to be done on the Hill and in the state to help prevent suicide? We're going to talk about that right after this. Stay with us.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
Nevada's direct link to Capitol Hill. Eye on Washington with Marilee Joyce. The only statewide Nevada news show based in Washington, D.C. All the top federal matters that matter most to Nevadans. Marilee talks with our congressional delegation and other leaders about the federal news you need to know. Eye on Washington with Marilee Joyce. Nevada's Eye on Capitol Hill.
I got got my own iPod Touch and use my dad's login to get on gambling sites. Poker is the best, but I'm losing a lot. Since I'm too young to play, they're not allowed to keep the money and my dad won't find out. That's right, isn't it?
Are you studying tonight? We can meet up and study together. Just text me after. Okay. No!
There is no text, tweet, or call that's worth a life.
One pedestrian death is one too many.
Look up. And look out for each other.
When I was your age, I was just like you, fascinated by stars. But now I get to search for life in the universe. And who knows, maybe life is looking for us too.
So we're like aliens to them?
Yeah. Does anyone want to be a scientist now?
I do.
Awesome. We need more girls in STEM.
Maybe we can find aliens.
Want more federal news that affects Nevada, its businesses, and its residents? Then you need to subscribe to Nevada's Washington Watch newsletter, your sole source of online news direct from Washington, D.C. Visit joycecommunications.com and subscribe today.
And we are back with our closing segment of Eye on Washington. We've had as our special guest today, Miss Ellen Shannon of the American Foundation for Suicide Prevention. As we close today, let's look at just two efforts on the Hill to turn things around. As I reported last fall, the House has been especially focused on veteran suicides lately, particularly on drug-related suicides. A bill introduced last Congress by Senator John McCain, the Veterans Over-Medication Prevention Act, would direct the U.S. Veterans Affairs Department to conduct a study to assess the relationship between veteran suicides and prescription medicine. And the most recent Nevada delegation effort was an effort led by now former Nevada U.S. Senator Dean Heller, who served on the Nevada Veterans Affairs Committee, called the National Suicide Hotline Improvement Act. And Ms. Shannon, I just want to get your take on what do you think? What's the big focus of yours and your organizations on what needs to happen on Capitol Hill to really help turn this crisis around?
Yep. Legislators need to make mental health a priority, and they need to invest in research. They need to invest in services to help people with mental health conditions. We need access to mental health care. We need to keep that mental health parity. We need to support our veterans and get them access to resources, trainings in schools, all sorts of things. So there's so much that our government can do to support this.
You know, I want to thank you so much for being here on this topic. And I before we close out, I want to do something that I'm sure you would think is the most important part of this whole show, and that's to say this: if you or someone you love is contemplating taking your life, we are urging you to call for help. The suicide number you can call is 800-273-HELP. That is 800-273-8255, 800-273-8255. Please call for help today. And please listen to that loved one, really hear what they're saying. God bless you. That does wrap up this week's Eye on Washington show. For more information on any federal issue that impacts you in Nevada, please visit our website, joycecommunications.com. Please be sure to like us on Facebook, follow me on Twitter, catch up with any shows you may have missed on our YouTube page. Thanks again for joining us today on Eye on Washington. I am Marilee Joyce in Washington, D.C. Have a good day today.
Thank you for watching Eye on Washington with Marilee Joyce. Eye on Washington with Marilee Joyce airs statewide in Nevada solely due to the generosity of our sponsors. Can your company help us continue our mission to remain Nevada's top source of federal news? If you can help us help Nevadans, please visit joycecommunications.com/WordPress/EOW sponsors and join us today. That's joycecommunications.com/WordPress/EOW sponsors.